Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Thursday. It is August 8th at 5:02 p.m. I found out today was National CBD Day. Who knew? Well, I found out and posted it on my page. If you guys didn't see that post, well, here you go. In case you are hearing the thunder in the background, it is, of course, raining again here in South Florida. Yes, it is summer. Okay, so let's continue talking about CBD. All right, we're going to talk today about dosing, how to use the product, side effects, etc. Okay, so I mentioned yesterday how Nature's Ultra labels all their CBD oils as topical use only. Now, here are some reasons you may want to think about to actually support that. Okay, number one, CBD absorption through the GI tract is variable. Okay, first it has to pass through the acidity of the stomach, and then it has, number two, is what's called the first pass effect. As it goes through your liver, it gets absorbed through the gut, goes through the bloodstream, through the liver, and leaves about 6% of the original that's absorbed in your blood. Okay, so number three, in the liver, it's metabolized into 8 different metabolites with variable effects. Now, that's if you take it orally. Okay, you take it, you swallow it, you take it as a gummy, you take it as anything that you would swallow and pass into your stomach. Okay, we're going to get onto that. Some feel that oral ingestion is best suited if you are actually taking it for gastrointestinal issues. Then it's perfect because it's going to get into the gut and it's going to kind of heal the gut from the inside out. Hey, Brina, thank you for watching. Okay, topical application is the transdermal delivery to target specific locations on the body, specifically if it's being used for pain or mobility issues. Okay, so if your arm hurts and you apply it to your arm, it's going to work right there. Hello, Slobodanka, how you doing? So the benefits, number one, it bypasses the liver's first pass effect, so it's not being metabolized and chewed up by the liver. Number two, there's higher bioavailability to the targeted area. You apply it to that area, it's going straight to those muscles or those areas that you're wanting to work on. Number three, Nature's Ultra combos with essential oils. Okay, so it's combined with essential oils, which helps increase the absorption through the skin. Essential oils are very tiny molecules, very fat-soluble molecules that help bring that CBD into your tissues, into your skin, into where you want it to work. Hello, Cecilia. Okay, and number four, lipophilic nature of it helps direct the molecules to storage in your fat cells. Okay, so then it acts kind of like a slow-release capsule, kind of seeping out all day long and giving you the benefits continuously, as opposed to one big shot and then it's gone. It gets absorbed, goes into your fat cells, and then kind of seeps out little by little all day long. Now, lastly, sublingual, okay? Putting it right there behind your teeth, under your tongue. Okay, although it is in your mouth, it is really not oral absorption. Okay, you're not swallowing it. I mean, eventually you swallow it, but the whole point is to put it sublingually and hold it there for a few minutes, allowing those blood vessels underneath your tongue, which are right there on the surface, to readily absorb the CBD and the essential oils, if you're using Nature's Ultra, right out of that area in your mouth. Now, you hold it as long as you can under your tongue, and it gets directly into the bloodstream. Bypasses the liver initially, so you don't have the first pass effect. And eventually it gets to the liver. Eventually the liver is going to metabolize it, but it's already passed through once or twice through your body, getting to the tissues that need to have that CBD brought in, binding to receptors, doing all that good stuff before it gets fully metabolized. Now, other forms of CBD on the market include gummies, vaping. Please don't do that, which for many reasons I do not support. Okay, I don't love the idea of gummies. It's too tempting for children to get into it and take too much. Vaping is horrific because you have no idea what it's doing to your lungs. And and that's another topic altogether. I've already done a live on vaping, so we can always bring that back to the forefront, and you guys can see why you don't want to ever vape. Okay, now what about dosing of your CBD oil? How much do you take, right? Okay, so there's no universally correct or required or suggested dose. It will vary depending on your body's biochemistry, your genetics, your state of health, your body mass, your percentage fat. Remember, we talked about being absorbed into the fat. So it'll also vary based on the cause or your degree of pain or the severity of the condition that you are taking it for. So it will vary based on the synergy originating from the blend of isolate and essential oils that you choose. Okay, so if you're using the Young Living one, the Nature's Ultra, it's going to be, the essential oil is going to actually increase the absorption, but you can vary the dose based on which oils you are taking, okay? And if you add additional oils. So I recommend starting slow, okay? And starting with a low dose. So start with anywhere from 10 to 40 milligrams and increase until you get the desired effect. Now, what do I mean by that? That doesn't mean increase the same day. It means take that one dose for a week. Some people say 2 weeks. Some people even say in pets for a month. Okay, but take it for at least a couple of weeks at that dose before you determine that dose is not effective. Okay, trust me. I've been using mine now for about 3 weeks, and at about a week and a half, I started noticing a difference, and I have not increased the dose. Okay. You can add additional Young Living essential oils to help keep the CBD dose lower as well. So if you wanted to add more frankincense or more peppermint or whatever it is that you're trying to support, I can make recommendations for you. Now, most full spectrum products have higher doses due to that competition we talked about yesterday, because it has hundreds of cannabinoids in there. They're all fighting for the same receptors. So the dosages are going to be higher because you need to get enough CBD in there for it to have an effect. Now, Nature's Ultra is currently selling their dosages of 17 milligrams or 33 milligrams per 1 ml dropper, and the bottles are 30 ml, so it's one for every day pretty much. You can take half a dropper full or even just a few drops. It's your decision. Depends on how severe your condition is. Now, remember, quality is what you should demand in your product. Okay, there are many fake CBD oils being sold. Actually, NBC Miami reported over 50% CBD oils they tested when they did a particular piece on the news had less than half the CBD advertised on the label, and some even had none. Okay, many others have THC, they have heavy metals and pesticides, even if they're organic. So do your due diligence. Okay, I did, and I use Nature's Ultra. So if you want, like I said, to use Nature's Ultra, drop me a line. I'll be happy to help you figure out which oil you want, how much, etc., etc. Hello, Shelly, darling. Now, quickly, side effects. Pure products, their side effects are actually very rare. You get the occasional stomach upset or nausea. Some people complain of diarrhea, tiredness. Most of the time, they pass as you continue to use it. Your body gets adjusted to it. Okay, but if it's severe, either drop your dose or stop it for a little while and reevaluate. Drug interactions are something you need to consider. So same thing is true if you're adding supplements. So always check to make sure. We talked about this, about how CBD is metabolized through the P450 system through the liver. If you have a drug that's metabolized through the same pathway, you're going to have to watch both concentrations. You're going to have to watch how your CBD is affected and how your other medications are. So you're going to want to do this with the help of a physician. Okay, so don't do this without consulting your physician first. That's what I have for you today on CBD. So happy National CBD Day. If you have CBD at home, go take some. I just rubbed some on my arm. It feels awesome. I love it. And I took my oral sublingual dose this morning. Tomorrow we're going to be talking about special populations. We're going to talk about children, pets, pregnancy, a little bit of cancer, having to do with CBD. So stay tuned for that. That's going to finish up our CBD series tomorrow. So hope you guys are having an awesome day. Thank you for watching, and I'll be back tomorrow for another Live in 5.